typically whenever organs are donated, the vast majority of organs that are donated are from people who have been clinically pronounced brain dead. Okay. We all know, right? Vegetative state, they're brain dead. They can't, basically they can't function without life support. Okay. They can't breathe. They can't eat, nothing without life support. That's typically where most of the donors come from. But recently, in recent years, as the system has pushed to increase transplants, a growing number of patients they've been using circulatory death donations, as there has been an increase in demand, right? So typically it would be from a brain dead patient, but in addition to, they're also now using more and more circulatory death donation. These are different. Circulatory death patients are usually on life support, often in a coma. Their prognosis is more of a medical judgment call, okay? They are alive with some brain activity, but doctors have determined that they are near death and won't recover. So that's the difference, right? It's not brain dead where doctors say they have no chance. Where they are brain dead, right? That's a medical diagnosis. No, this is something different. This is more of a judgment call. This is the doctor looking at them and saying, I don't think they're going to pull through. I don't know if they're going to pull through. Okay. So that's circulatory death donation, which is different. And there has been a rise in this. There has been a rise in this in recent years. And so if relatives agree to the donation, the doctor will cut off life support, wait for the patient's heart to stop. This is how circulatory death donation works. Wait for the patient's heart to stop. And the rules say it has to happen within an hour or two for the organs to be viable. And after the person is declared dead, then the surgeons go in. Okay, so this is a case of them removing someone who they have deemed is not going to recover from life support, letting them die, and they have to be dead for a certain amount of time, like that first one that we talked about, how she was pronounced dead for 103 minutes. There's a certain amount of time they have to be pronounced dead before they can actually go in and procure these organs.